Hi, Jennie Helmer here. I'm in the ECC virtual way this week. It's Friday, May 8th. I'm here with Leon Baranowski, Richard Armour, and we are going to speak to you today about practice update that's being released to all paramedics in the province. Thank you.
Thank you, Jenny. A couple notes from Clinic Hall. A reminder to crews to continue to do high-quality PCR documentation, to be clear and accurate in the information provided, to include any treatments provided on scene and during transport to the hospital, as well as to include any documentation of conversations or decisions made about patients' care. Also, it's important to note that our secondary triage program will be expanding. That's a partnership with our clinical nurses and paramedic specialists doing telephone triage interviews with patients prior to an ambulance being sent and to find the best course of action for patients' care. Some patients will still need to require a face-to-face ambulance assessment or transport to the hospital. There is a small percentage that even after an ambulance assessment will refuse transport to the hospital. We encourage you to follow your standard refusal of care guidelines, and if at any point you're in doubt, contact Clinic Hall for further advice.
In consultation with patient care delivery and clinical medical programs, BCEHS Learning has developed a 4-hour bundle of courses related to the COVID-19 pandemic for all members of clinical staff. This 4-hour bundle is now available on the Learning Hub, and staff are able to enroll independently. The course will cover topics such as the pathophysiology and epidemiology of COVID-19, and for PCPs and ACPs there will also be a course about assess, see, treat, and refer for influenza-like illness patients and palliative care patients. Finally, there will be a review of all the new PPE guidelines covered during the COVID-19 pandemic.
Thank you, Richard. Jennie Helmer here and Leon Baranowski. We are going to discuss the A-STAR clinical pathway for palliative and for influenza-like illness that's being released today, Friday, May 8th, and I'll let Leon speak to this.
So over the last 12 to 18 months, a rather large project team led by Michelle Britton and led by Jennie has been working to pull together all the different stakeholders around the province and organisationally within BCEHS to see exactly how we can make this work. And so whilst we know there's been a lot of conversations asking about this practice, we just kind of wanted to let everybody know that this is no small practice change. This is a fundamental shift in the way that BCEHS will do business in caring for patients going forwards, and that required a lot of structural and administrational changes to this practice. And they included CAD, Siren, as well as the BCEHS handbook. So we're really excited to be able to kind of present this to you right now, and we're going to give you a little bit of context as to the criteria behind assess, see, treat, and refer, or A-STAR, and some of the really important practice things that you need to do in terms of documentation and our professional standards when undertaking this practice of leaving people at home and referring them on to other healthcare agencies.
Okay, so the assess, see, treat, and refer pathways are new to us at BCEHS, and they come from a history where we traditionally assessed patients at home and transported them to hospital. That's been the main function of BCEHS for a number of years, and in 2018 we received ministerial orders from the province of BC that essentially allows paramedics with appropriate procedures in place to assess patients in their home and, using a safe and collaborative approach to care, consider non-conveyance where patients fit an appropriate inclusion criteria. So palliative patients are the first patients to become a part of the clinical pathway, and this is also followed now by influenza-like illness patients. So Leon, do you want to tell us a little bit about that?
Yeah, so we don't want to go into too much detail and ruin the surprise for you with the education that's been provided in the bundle, but we wanted to just give you some high-level points to think about and take away as you undertake this practice. And to Jennie's point, we want to be able to ensure that we provide safe, patient-centered care, and that our practice around documentation and the way that we communicate this with patients remains kind of at the forefront of our practice, because other members of the healthcare professional teams are going to see your documentation and they're going to see our practice and need to really understand what care we provided for patients. With regards to the ILI and the palliative pathways, there are also a number of different assessment tools that have been made available to support you in your decision making, as well as the continued use of clinical should you have any questions.
Excellent.
So kind of as Jay mentioned right at the beginning here, this is a brand new practice to BCEHS, and we understand that over time our practitioners and paramedics will need to become comfortable and confident in their ability to use these pathways to practice, and that there are supports out there. You can contact your regional paramedic practice educator. You can contact clinical anytime 24/7 using the number up on the screen now. Or you can reach out to one of the paramedic practice leads and we'll be able to take you through questions and concerns around the practice and help you and support you in your ability to provide care for these cohorts of patients.
Thank you, Leon. These are exciting times, and these two pathways start to paint a bit of a picture about where the future of paramedicine is heading. And we do anticipate that there will be more presentations that become a part of SSC Treat and Refer, and what those presentations are and how we roll them out will depend in large part how we evaluate the current state and how well this next phase goes. So please do reach out if you have questions or comments and anything that you think we can do to make the process better and improve it for patient care. And we look forward to this next era in paramedicine.
Finally today, as part of the ongoing project to improve the access to analgesia within pre-hospital care in British Columbia, excited to announce today that acetaminophen and the associated cups of water are now available for order on PDC for use by primary care paramedics and advanced care paramedics for minor analgesic requirements. Primary care paramedics and advanced care paramedics should go to the BCEHS handbook and review the drug monograph, indications for use and contraindications.
Thanks everyone for your time today. Just a quick reminder that if you have any questions, feedback, etc., you can contact any of the paramedic practice leaders at clinicalpractice@bcehs.ca. Thanks again and have a great weekend.